Hi everyone, I'm Michelle, one of the heart doctors from National Heart Center, and today I'll be talking to you guys about calcium scoring in cardiovascular risk stratification. I have no relevant disclosures. So before we even talk about calcium scores, I think we need to understand how the pathophysiology of arteriosclerosis, which is the medical term for how your blood vessels get narrowed, actually happens. So here we have on the left side a very healthy vessel. So all of us are born with healthy vessels, and basically they are clean. There is no narrowing. As we get older or we start picking up habits, we start smoking, we have high blood pressure, diabetes, or even a high cholesterol, there is wear and tear and there's injury to our blood vessel. Okay, so for example, like smoking, there are chemicals that are released and inhaled and they start to form injury. And you can see here that depicted by the yellow color fatty layer in the wall. This could happen when an injury occurs. When you have high blood pressure, there's a lot of tension on the blood vessel wall, and that also causes injury to your blood vessels. In diabetes, because there is so much high sugar in your bloodstream, it causes inflammation in your wall as well. And when you have inflammation in your wall and the blood has a higher concentration of bad cholesterol, in this case is the LDL, it would also start to deposit in the wall of the blood vessel. Okay, so this is a continuous process and occurs and accumulates over time as we age. Yeah, so it accumulates over time and it gets thicker and thicker. The amount of deposition increases as well. So up to a certain point, of course, it gets so the amount of cholesterol that is deposited or injury in your wall is so bad that it starts to occlude the blood vessel passage itself. Yeah, so there's a narrower hole for blood to flow through. And at one point, because when the cholesterol is so thick, the core of the cholesterol actually starts to die. Yeah, the fat cells within it starts to die, and it forms calcium within it. And therefore, we use this detection of calcium and concept to kind of like form the basis for our calcium scoring scan. Yes. So what is a coronary calcium scan? Basically, now we know that calcium can be, identified. It is found in narrowings of your blood vessel at a very late stage. We therefore use this concept. We use the concept of, calcium appearing white on your X-rays. And then under many, many, many X-rays, we therefore know that, hey, I can shine an X-ray many times using a CT scanner into my blood vessels of the heart, I can actually potentially detect calcium in my blood vessels. So in this, there are 4 different scans here on the right, showing different patients with different levels of calcium score. So on the first top left, you can see a patient with a calcium score of 0. So there is nothing that you can see within the boundaries of the heart itself. And then on the top right, you can see a patient with a calcium score of 29. So you can see one small dot there. That's not too bad, right? So we are able to kind of translate that into a scoring system after we do the scan. On the bottom left, you can see that there is a patient who has a higher calcium score than the one on the top right, and that is a calcium score of 250. So there are more dots. There are more white stuff that you can pick up. And finally, on the bottom right, you can see a patient which has the worst calcium score, which is a lot of bright white stuff within the blood, the heart itself. So this is basically what a calcium scan is and how it detects calcium in your arteries. So how is it performed then? So first of all, you would be put into a CT scanner, right? It would involve some level of radiation, but there is no IV contrast given. So you just lie there. The nurses would then hook you up to a ECG monitor so that we can kind of follow your heart cycle as it pumps. And then we can scan you. It's probably 1 to 2 minutes before we get our scan of your heart. Okay, so here showing in a video format is as different slices of your heart as I scroll through the heart itself. And you can see here that I don't really see any calcium. In this picture, we've actually used pink to highlight the calcium. So you see all the white here is basically your rib cage. And within the heart itself, you don't see any pink stuff that is coming up. In contrast, on the right, this patient has a lot of calcium within the heart boundary itself. You can see there's a lot of pink color pickup. Let's run through that one again. Yes, and it's in different areas of the heart, right? And we are able to actually correlate these areas to the different 3 different vessels that supply our heart muscle. So as explained earlier, we can actually translate the amount of calcium by looking at the density of it into a number. Yeah. So in this case, for this patient, his total calcium score is a 2,469. So you can scroll here. If I scroll here, I can detect different calcium in different blood vessels, which I've highlighted in different colors. Yeah. So clearly, of course, in this patient, he has a very high amount of calcium, and therefore he has a very high risk of coronary artery disease. Perhaps this scan is probably not the most appropriate scan for this patient because, when it's so high, it will be difficult to tell now, he will have to do other scans, right, to kind of find out what's going on with his heart. So just to put it in numbers, basically we kind of divide the calcium score into different levels. So if you have no calcium at all, of course your calcium score is going to come back at 0. And that's great, right? But there are a few caveats to this, right? You remember the disease process. So it just means that there isn't any narrowing that is bad enough to form a calcium right at the end. You could still have some early narrowing, right? From just the fatty deposition, but it isn't severe enough to yet form a calcium. But overall, your overall risk of having any bad, obstructive heart disease or having a heart attack is very low if your calcium score is 0. Once your calcium score is above 0, then that's a whole different story, right? Because you already have underlying arteriosclerosis, yeah. And we have kind of tried to grade different grades of the calcium score, like 1 to 100 is mild, 101 to 400 is moderate, and more than 400 is severe. But at the end of the day, we don't just look at the calcium score alone. We have to include your other risk factors, like, do you have a positive family history of heart disease? Is there a history of smoking in the past? So all this would change the risk profile for yourself. So the calcium score, in essence, has very high sensitivity, but it has moderate specificity. So meaning to say that, if your calcium score is 0, great. You don't really need to be so alarmed. Continue your healthy lifestyle. But if, let's say, you do have a positive calcium score, then it may or may not, mean that you have artery disease that is severe, right? Because it depends on the level of the calcium that is detected. So therefore, it is important to understand who is suitable to go through a calcium score scan, yeah, because there are so many different tests that are available to look at patients with heart disease. First of all, for a calcium score, you need to be asymptomatic, meaning you shouldn't have some chest pain, You shouldn't have some breathlessness when you are exerting that is out of your normal. If you were to have those, then of course there will be other tests that will be more appropriate for you lah. The second thing, of course, is that you need to be of a certain age. We say roughly between 40 to 75. Not younger than 40 really, because if we would imagine that, you know, the disease process of arteriosclerosis takes time to happen. And if you are younger than 40, we feel that the pickup rate is going to be very low because you wouldn't have well aged enough for the calcium to form in your blood vessel. Not say that you can't do it. It's just that, you know, the pre-test probability is going to be very low of it being negative lah. Okay. If you're older than 75, so as you get older with age, right, all of us, we are going to undergo some form of wear and tear in our blood vessels, whether or not you have risk factors or not. And we'll all start to have some amount of calcium as we get older, right? The important question here is the calcium enough to cause you to have symptoms by obstructing your blood flow to your heart or your brain? So usually we would say that, you know, if you're more than 75, most likely you're going to get some calcium in that is detected, and therefore this test alone is not going to add any added value to what we already know. Yeah, this test alone is not going to add any added value. So for the third thing is that you shouldn't have any known arteriosclerotic cardiovascular disease, which is in short ASCVD. So you shouldn't have had a known history of already known blockages in your blood vessels lah, be it in your leg, having had a prior history of stroke, or already know that, hey, last time I did a scan and I already got some calcium, then no point repeating the calcium score again, right? Fourthly, you should have pretty much a low risk profile. Yeah. So meaning to say that, you know, if you do have diabetes or cholesterol, blood pressure, you have had a smoking history, your BMI is elevated, or your kidney function isn't the best, you have a family history of positive, you know, heart disease, or you have some form of inflammatory disease like vasculitis, rheumatoid arthritis, psoriasis, or even HIV. These are diseases that actually already increase your inflammation of your blood vessels. And a combination of this would already put you at a much higher risk of having heart disease. And we would therefore assume that your likelihood of having a positive calcium score is going to be very high. In which case, this calcium score alone is probably not going to be enough to characterize your risk profile. Yeah. So it is not really the best option for you to undertake. Yeah. And fifth, technically, if you're not already on a moderate intensity statin, you can go through a calcium score. So for example, if I'm the reason why I say this is because when we have a positive calcium score, besides, you know, trying to control your risk factors, sometimes a doctor will ask you, are you already on a cholesterol lowering medicine? If you are not, then we will start it for you, really just to reduce your LDL cholesterol in your bloodstream that helps to increase your risk of the blood narrowing forming. Yeah. But if you're already on the statin, then there's maybe less value because you're just going to be, you know, trying to stop smoking. You're just going to be trying to control your blood pressure and control your sugar levels lah. And that should be done regardless of whether you know your calcium score or not. Yeah. So in essence, if you are already on a statin, well, there's not going to be much added value lah, right? Because if you're on a statin, you go for a calcium score, it is not zero. I would say maybe we just bump up your statin a little bit more. You aim a lower LDL target. But if you're already on a, you know, a statin that's high, or your LDL is good enough, then perhaps doing this scan may not add much benefit to, you know, overall your treatment process. And finally, you shouldn't be pregnant lah, because the calcium score it's still a CT scan. There is still radiation, as I explained earlier. So let's go through some case examples. So this first example is that of a 55-year-old male. He is an active smoker, and his father has had 2 coronary stents placed when he was 50 years old. He also has diabetes, and he tells us that he has some breathlessness when he walks up the stairs. So do you think that in this case, would a coronary calcium score be suitable for this patient? Well, the answer is probably not. Okay. And the reason I say this is because he has a very high risk profile. So first of all, he is an active smoker already. That's number one. He has a positive family history. Yeah, his father has 2 coronary stents placed. He has diabetes. Okay. So these are 3 risk factors already. And fourth, he has symptoms. So he's complaining of this breathlessness when he walks up the stairs. So he probably needs a stress test instead of just a calcium score to assess what's happening, or even a direct coronary angiogram. Yeah, because he has quite a high probability of having obstructive coronary artery disease. And a coronary calcium score test alone is not going to add much added added information. For case example B, now here we have a 60-year-old male. He's a bit overweight. His BMI is 35. He doesn't have any symptoms. He has an LDL cholesterol of 4.9. Yeah, so in Singapore, ideally our targets should be less than 3.3. Optimal, of course, if you can go as low as 2.6 lah. So he already has a bit of a high LDL cholesterol, which is the bad cholesterol. And he's right now, even though his GP asked him to start on cholesterol medication, he's not very keen for it. Then he comes and says, should I do a coronary calcium score, right? Is it suitable? Then I would say, to be honest, it depends, right? It really depends on whether he is willing to take the medication for the statin, which is to lower your LDL cholesterol. So if let's say he says, hey, doctor, I need more information. I need to be convinced to start my cholesterol medicine. This high cholesterol number itself is not good enough for me. I need more information. Then sure, we can do a coronary calcium score, because if it is abnormal, not 0, then there's more reason for him to be on the LDL cholesterol lowering medication. However, he says, actually, okay lah. I mean, if I don't do the scan, I have already decided I want to start, the medication regardless. Then I think there isn't really any added benefit to doing the scan. You can really start the cholesterol medication without the scan, because you have an indication for it, a medical indication for it, and you can lower your LDL as low as 2.6, or if you want to be a bit more aggressive, 1.8, without doing a calcium score on its own. Yeah, so therefore in this case, I would say it really depends on what is his intent. For case example 3, we have a 49-year-old female. She is not overweight. Her BMI is 23. She isn't a smoker, but she is postmenopausal. Yeah, her mother had a heart attack at the age of 45 years old, which is relatively young for a female. She doesn't have symptoms, and she exercises regularly. So actually, I mean, for this lady, she looks like she's leading quite a healthy lifestyle lah. But then, she comes to you and say, hey, doctor, is there anything else I can do to really lower my risk of heart disease lah? Yeah. So in this case, I would say her calcium score is suitable. Yeah. Okay. And the reason for that is because, she has no medical history. She has no high cholesterol, but she does have a risk factor, meaning, her mom has had a heart attack at 45 years old. she's postmenopausal, so that, you know, for women, when we are still on our cycle, it actually has protective hormones that, you know, reduce our risk of heart disease. But once you are postmenopausal, this, you know, benefit kind of goes away. So I would say if she is willing to, you know, take any means to actually lower her risk or find out her risk of, you know, having a cardiac event, then doing a coronary calcium score would be suitable in her case. So here are some take-home messages from this presentation I've shared with you. First of all, the calcium score is only appropriate when, number one, you have no symptoms at all. You are between the age of 40 to 75, roughly. You have no known cardiovascular disease, like your, you know, no known history of vessel blockages in your leg, stroke, or heart disease itself. You should have a low profile. That means if you do have diabetes, high cholesterol, high blood pressure, a history of smoking, a high BMI, or any other, you know, risk modifiers, like, you know, having kidney disease, positive family history, or inflammatory diseases, then you may not be very suitable to undergo this test alone. Fifth of all, you shouldn't be already on a moderate intensity statin. And like I mentioned earlier, it really, you know, is because you're already on a medication to help lower your LDL. Doing the scan may not add much value because you're already on that medication, but it can potentially change the target of your LDL. So instead of the normal 2.6, as with anyone with high cholesterol in the community, if you do have a positive calcium score, then I would say you can go down as low as 1.8. Yeah. So if you are able to go down to that level without even doing a calcium score, then I say there's no value in doing the calcium score. And last of all, if you are not pregnant, so as mentioned earlier, calcium score involves radiation. The second take-home message here is an abnormal calcium score doesn't necessarily mean that you have obstructive coronary artery disease, right? So this is obstructive coronary artery disease is when you start getting symptoms, okay? The blood flow is not enough to, you know, supply oxygen to your heart muscle. However, so it's like any other risk factor, right? Abnormal calcium score is equivalent to having high cholesterol. It is equivalent to having high blood pressure. It's equivalent to having diabetes, but this doesn't necessarily translate to having obstructive coronary artery disease. However, it does mean that, you know, the disease process has started. It does mean that you have arteriosclerosis, means the narrowing has started, okay? And what can we do about this, right? So, you know, don't panic. Basically, it just boils down to, you know, managing all your risk factors. Yeah. So that means losing weight. Yes. Stop your smoking or reduce as much as you can. Control your blood pressure, glucose, and cholesterol. Exercise. And of course, eat healthy. So these are all the things you can do once you know that you have an abnormal calcium score. And finally, if you are already not on a statin, you can schedule a consult with your, you know, primary doctor to actually discuss starting on cholesterol lowering therapy. Okay, that's all I have for today. Thank you guys for your kind attention.